nurse today. Nice to meet you. So today you're going to go through a drug called cyclophosphamide as a part of your chemotherapy. So I want to give you this patient information leaflet and just go through this potential side effects of this drug. Is that okay?
Certainly, thank you.
So this side effect is called hemorrhagic cystitis that involves the inflammation of the bladder as well as the bleeding of the bladder as well. So it causes inflammation and bleeding of the whole bladder. So this can happen during the treatment, immediately following the treatment, or just months following the treatment.
What can I do to prevent it?
Yes, I can provide you with some tips. Basically, if you stay well hydrated, you can prevent it. So you can drink about like 2 liters of water every day, and it's best to avoid alcohol and coffee, and empty your bladder regularly as much as you can. And also it's better to report any symptoms and recognize them early as much as possible, such as like blood in the urine, or if you have any frequency and urgency of urination, or if you have painful urination, if you have any abdominal pains, or if you just have to get up frequently at night to pass urine, any of these, please report and get back to the hospital. And also you'll be provided with some tablets called Mesna that should be taken every 6 hours as advised by the pharmacist. So that also helps to prevent the occurrence of hemorrhagic cystitis. So you can go through the information sheet. So it's very simple information. And do you want me to go through the information again?
No, I think it's quite straightforward to understand, and I don't have any questions.
Just for my own sake, I just want you to just go through those tips again to me, so I just can make sure that you understood it really well.
Okay, so I need to drink 2 liters of water a day. I shouldn't drink tea or, I shouldn't drink alcohol or coffee.
Mm-hmm.
I need to urinate regularly
Mm-hmm.
and not hold the urine in my bladder for long.
Mm-hmm.
If I see any blood in the urine or have pain down in that area, or I'm visiting the loo more often than I usually do, I need to call.
Yeah, you can call us, yeah.
And also I need to take the Mesna tablets every 6 hours.
That's great. I think you have understood it really well, but I'm very happy to give you more information and go through the same topic over and over again. Please don't hesitate to ask me. So I'm just getting everything ready for you. I'm just going to like gown up and get the lines ready and get the drugs out from the pharmacy and all that. So just think over the information again. If you have any questions, please don't be hesitant to ask any of these questions if you have, and I'll be so happy to clarify them with you before I start the infusion.
Oh, lovely.
So
Thanks, Binny.
So hi, Miss Ray. How are you today?
Not too bad.
So today you're going to get a drug called cyclophosphamide. So I wanted to give you this patient information sheet and go through with you the potential side effects. Is that okay?
Okay.
So this is hemorrhagic cystitis is one of the side effects that I want to explain to you in detail. It's essentially an inflammatory process of the bladder and the bleeding involving the whole bladder. So this can occur during the treatment, immediately after the treatment, or months following the treatment.
What can I do to prevent it?
Yes, I can give you some tips to prevent it. So stay well hydrated throughout the treatment. Avoid alcohol and caffeine, and you can void regularly. And you should recognize and report any symptoms such as blood in the urine, frequency and urgency of urination, painful urination, abdominal pain, and nocturia. And also the pharmacist will be providing you with some medication called Mesna, and you should be taking it regularly as advised by them. And Miss Ray, I'm very sure that's a very simple information. You probably have understood it really well. And I'm going to go ahead with the chemotherapy, and I'm sure you don't have any questions, have you?